So I'll start off today's presentation with a quick review of the Prospect T1 and the M-Series compact MRI systems. Before we begin though, I'd like to take a look at the agenda for today. So as I mentioned, I will talk about the Prospect T1 high frequency ultrasound system, as well as the M-Series, our compact MRI system. I'll touch briefly on the 5.2 fluorescence in vivo endomicroscopy system. And then Katie will take over talking about our Newton 7 optical imaging system, the Super Argus system, which is a PET CT. And as well, we'll take a look at some of the images from the live demonstration throughout the presentation, but at the end, we'll show you a compilation of images acquired on all of the different instruments during our live demonstration on the same animal. So right now, we'll start off with a high frequency ultrasound system called the Prospect T1. I'll give you a brief technical overview of the system, and then we'll take a look at some of the images that we acquired during the live demonstration last week. So the system itself is actually a tablet-based system, and you can see that tablet here. This is the screen on which you'll do all of the image acquisition. The electronics for the system are actually tucked in behind this screen, and so the footprint for the system is very small. So again, we have the tablet. The ultrasound probe is actually connected at the bottom here and mounted into the scanning platform. The platform itself, I'll go into a bit more details, but what you see here is really all of the components of the system itself. The system is, there's 3 different probes available with the system, a 20 megahertz, 40 megahertz, and 50 megahertz probe. Traditionally, the 20 megahertz probe is used for rat imaging, as well as harmonic contrast imaging. The 40 megahertz probe is used for mouse imaging of superficial targets as well. And the 50 megahertz is very much used for superficial anatomical targets. When we talk about a probe being used for mouse or rat, that's just their traditional use. And when we're talking about ultrasound, we think about frequency as it relates to depth of penetration. And so as we go down in frequency towards the 20 megahertz probe, we increase the penetration, and that's where we would typically use these probes on rats. The 40 megahertz would get all the way through a mouse. But if you were looking at a superficial anatomical target on a rat, such as, for example, the carotid artery, you could use either the 40 or 50 megahertz probe to provide you with higher resolution images. So it really just does come down to a conversation about the research that you want to do, the animal models, as well as your anatomical targets to understand which probe would suit you best. The scanning platform has many different components. The first that you see here is the mouse and the rat platform. Both platforms are heated. They do have ECG leads, which allow us to obtain the ECG signal from the animal, as well as to give us respiratory signal. There is a rectal probe to give us body temperature, and that also helps in the feedback loop of the system. The probe itself is mounted into the holder and can rotate and tilt in all different directions. And then the different components of the scanning platform allow it to rotate basically 360 degrees, depending on what angle you need to obtain the image that you're acquiring. The platform itself can also tilt, and there's micro manipulators underneath to move the probe, the stage, left, right, and up and down. The system is configured with all of the software modes available. So both the mouse and the rat configurations would come with B mode or brightness mode, M mode, all of our Doppler modes, including tissue Doppler, contrast imaging, again, linear as well as nonlinear contrast or harmonic imaging are available on the system. All of the measurement tools do come within the software, and it's an option to get the offline analysis software with the system as well. In the mouse configuration, we would traditionally include the mouse bed as well as the 40 megahertz probe, but we also have that 50 megahertz probe as an option. If you wanted a system configured to do both mouse and rat, then we would simply add on the rat table and the 20 megahertz probe, as those tables are completely interchangeable within the system. There's a few add-ons with the system that would be important to understand what you wanted to do with the system to understand if they were appropriate. One of the add-ons that we used during the demonstration was this 3D motor, and it simply mounts onto the side of the scanning platform, and it will basically translate the stage underneath the probe. and you have the ability within the software to define the step size or how far between each slice, as well as the distance you'd like it to travel so that you can acquire the full three-dimensional coverage of the tumor that you're looking at. And included with that option is also the software to do the visualization of the 3D acquisition, as well as tumor volume or volume assessments using the 3D ROI tool. Additionally, there's an option for an image-guided injection mount, and this simply mounts onto the probe holder, and it can hold any type of needle. So here we have a standard syringe with a steel needle, but you could also use a pulled glass capillary needle if needed. The images that you're seeing here is actually an externalized embryo with a pulled glass capillary needle going into the brain of the developing embryo. And these embryos could then be placed back into the dame and delivered, and the effect of whatever was injected could be observed. The other image that you're seeing here is using a steel needle to do an image-guided injection into the myocardium. Here you're looking at a short axis view, and you can see the tip of the needle, and you would be able to inject, for example, stem cells into the border zone of a myocardial infarction, as an example. I'd like to move now to some sample images that we acquired during the live demonstration last week. I've included a few additional images, and I'll point out those that we did not acquire during the demonstration. So when we talk about doing tumor imaging, and we'll start with these, we typically will start with 2D B mode imaging. B mode, again, being brightness mode. It gives us a very good two-dimensional image of the tumor. It helps us to identify the tumors. We can do basic linear as well as area measurements. We can look at surrounding structures, and I'll show you an example of that in the next image. And as well, we of course can use this longitudinally because there's no invasive procedures needed to acquire these images. The two images that we see on the right-hand side here, both were not acquired during the demonstration for a few reasons. The first one being power Doppler. There was a technical issue with the system, so I wasn't able to demonstrate this capability, but it does allow you to assess the tumor vasculature using signal that's endogenous to the tumor itself. So it's really the twinkling that we see on the screen caused by the red blood cells moving through the image. And we apply a color overlay to be able to assess the tumor vasculature. Contrast imaging is also possible with the system. We didn't have approval or have access to microbubbles to do an injection, but this would typically be used either in a linear or a subharmonic or nonlinear fashion to be able to acquire the tumor microvasculature. So you do an IV injection typically through the tail vein, and we would be able to see the contrast agent flow through the areas of the tumor which were perfused. We can then draw various regions of interest and look at that time versus change in intensity to assess the microcirculation within the tumor. So here we see some images. These ones were from a SCOV-3 injected animal. So there was an IP injection of the ovarian tumor cells, and these tumors can form anywhere within the abdomen. And so this is quite a complex model, and it took looking around and finding these structures and identifying them. Most importantly, we had to identify normal structures before we could identify abnormal structures. And so what we see in the middle here is actually pulsing, and that's actually a cross-section of the aorta. Next to it is the vena cava. And then we identified the kidney sitting here, and the vessel that we're seeing going over top of the kidney is actually the splenic vein. This is the left side of the animal. And we were able to identify in a different plane the spleen quite nicely. We identified a structure which looked quite interesting sitting in the area of the pancreas. So really the pancreas is a non-encapsulated organ within the mouse. And so if we identify the stomach, the spleen, and the kidney, the pancreas is filling that space. And so what we identified here was an interesting structure, and we watched for a little while to ensure that it wasn't the intestines. And so the intestines over time will begin to move with peristalsis. The tumors, on the other hand, will not. And so we're able to differentiate the structures from one another. And so we were able to identify this tumor. As I moved through the abdomen, I was able to identify other tumor structures, some of them connected to this one and other ones not. And again, that's simply because the tumor cells were injected intraperitoneally and they were found to form throughout the abdomen, and that's very much how this model progresses. So in this other image that we have here, we identified the stomach as well as multiple views of the same tumor. This tumor actually does connect higher up in the abdomen, and I was able to track that along the abdomen and be able to see how these tumors connect. We, of course, can do 3D imaging as well. So the other tumor model that we looked at, and you've already seen images from, was an orthotopic mammary fat pad tumor using 231 cells injected orthotopically, again, into the mammary fat pad. So here we took quite a large swath of area that was covered with a 50 micron step size. And in doing that, our image was acquired in the green plane below, but when we stack all those slices back together and we can reslice in any orientation, we get a really high resolution image in all of those different orientations. So we can see how the tumor was forming. If we did this on the abdomen, we'd be able to see the interconnected nature of those different tumors as well. We again can use the software to quantify the tumor volume. And so here we found the tumor volume to be 263 millimeters cubed. We can use this technique, like I mentioned before, to study the tumors longitudinally and watch how they grow or how they respond to therapy. Because again, it is non-invasive. The animal is simply under anesthesia for the short time that it takes to acquire these images. And if you were with us during the live demonstration, you really did see how fast we were getting images. So 2D B mode is in real time. So as soon as the probe touches the gel, you would get those images in real time. These three-dimensional images, there was probably 300 or so 2D slices taken to generate this, and that would take well under 1 minute. So it was quite a quick acquisition to get to the images that you see here. This is actually a 3D of the abdomen of that SCOV-3 animal. And so going through and acquiring the image, this is very similar to the image that I showed you in 2D. But then if we slice down from the top of the animal, we can actually see how these tumors are interconnected as we go through the abdomen, and then the longitudinal slice of that tumor as well. After I finished the tumor imaging, we moved on to do a full cardiac exam on the mouse as well. And so here we can see a parasternal long axis view. So what we're looking for here is a nice open aortic root, as well as a very open apex of the heart as well. Traditionally, the Prospect T1 has a frame rate of about 30 frames per second, as it is a single element transducer system. And that is that the element wobbles back and forth. There is this ECG gated kilohertz visualization mode, or EKV mode, and I forgot to change the number of frames per second, but this would be 190 frames per second. So this gives us a really nicely resolved image of the heart and how it's moving. If you had an area of infarction, you'd be able to see very clearly the area that wasn't moving, the area that was functioning well, and that area that's kind of in the border zone, which may be taken along for the ride by the area that's functioning well or contracting ever so slightly. We then move to a short axis view, so we're able to see very clearly the short axis view of the left ventricle with the papillary muscles clearly in view. Moving on to a traditional M mode image. So again, this looks at the motion along a single line to see how the heart or the myocardium is contracting over time. And with all of these, you can see that they're absolutely aligned with the ECG signal acquired from that animal as well. And so from here within the software, there's a full complement of different analysis options available. So you can do measurements from a B mode image, an M mode image, combined B mode with pulse wave Doppler, which I'll show you in a second as well. Every possible measurement that you can think of is included within the software. And again, you can perform that either on the system or in the offline analysis software. And that's always nice to do because you can take the images back to your desk and sit and do the analysis while someone else is acquiring images on the system in your vivarium, for example. Moving on to pulse wave Doppler. So this allows us to look at how the blood velocity is on our y-axis changes over time. And so here we're looking at the pulmonary artery as it comes out of the right ventricle, and we're able to see very nicely the waveform that we're getting from there, and could very easily make measurements of peak velocity as well as area under the curve. The little spikes that you're seeing as they come back, as I described in the demonstration, are actually the valve leaflets closing. And that tells us that we're right at the valve outlet, which is exactly where we want to make the measurement, and we want to do that reproducibly. The black void that you're seeing inside the envelope is also very important. That tells us that where we're sampling from is right in the middle of the blood vessel, and we're getting laminar flow. So that means that all of the blood is traveling at the same velocity over time. If we had stenosis or we were towards the edge of the blood vessel, we would actually see this envelope filled in almost entirely because blood would be traveling at all different velocities. And so these are all the things that we look for to be reproducible in the images that we're acquiring. We then moved on and took a look at the mitral valve flow. And so here the very characteristic E and A peak were clearly visible, as well as the aortic outflow. And from here, there's different measurements which become important. First of all, with the mitral valve flow, when the ventricle is relaxing, this is when we get our E peak. This is the passive filling or the early filling of the ventricle as the muscle relaxes. And then the atrium contracts to give us our A peak, which is when the atrium contracts to push all of the remaining blood through. Traditionally, in a healthy animal, the E to A ratio, the velocity ratios here, are going to be higher than 1. As you get diastolic dysfunction, where the heart is no longer able to relax well, then this ratio is going to change. And within the software, you have the ability to measure these velocities and it will output the ratio for you. Additionally, there's a capability to measure the myocardial performance index, which takes into account some of the timing intervals. And so it takes into account, for example, the isovolumic relaxation time. So this is when there's no change in blood moving or blood velocity until the heart begins to relax enough to change the volume. It also takes into account the isovolumic relaxation time. That was relaxation time, sorry, contraction time. Similarly, as the ventricle is entirely full, as the muscle begins to contract and begins to push the blood out through the aorta. As well, it takes into account the aortic outflow time. Again, you can make all these measurements within the software and the system will calculate the myocardial performance index for you. You can make these measurements multiple times and it will give you the average as well as the standard deviation. You can create a combined report where you're making many measurements on the same animal, or you can just export that specific measurement itself. All come out in a CSV or comma separated value format, so that's easy to put into Excel and to pull all of your data together. On the left-hand side here, we're actually looking at the left common carotid artery of the mouse and moving down to the internal and the external bifurcation. One of the things I've failed to mention so far is actually the scale bar on the right-hand side. So we can all imagine how small the carotid artery is of the mouse. The scale here on the right-hand side is actually in millimeters. So from 11 to 10 is in fact 1 millimeter in space. So very high resolution images. This was taken with the 40 megahertz probe. So it would give us 50 micron resolution. One of the other modes that I wasn't able to demonstrate during the live demo just because of a technical issue with the system was color Doppler. And so here we're actually looking at the aortic arch. As we see the blood flowing towards the transducer, it's going to be red. And as it flows away from the transducer, it is blue. And so color Doppler really helps us to identify directionality of blood flow as well as velocity. We can see the scale here in the upper left-hand corner. And then we'd use this to place our sample volume for the pulse wave Doppler. So it can be very helpful, especially when looking at the mitral and tricuspid valves, to be able to place your sample volumes in the highest velocity flow within the ventricles to be able to get a very nice assessment of the cardiac function. Moving now to the M series, or our compact MRI system. This is the last system that we demonstrated during the live demo. So again, I'll give you a brief technical overview of the system, and then I'll show you some of the images that we acquired during the demonstration. So the system is made up of 3 different components: the magnet itself, the workstation, which includes the acquisition software, as well as the electronics cabinet, as well as any of the accessories and add-ons that would be added to the system. So the magnet itself is quite small. We saw that in place in the lab during the live demo. In that room, as you may remember, there was a PET MR system, which actually had one of the larger magnets, the M5 magnet from Aspect Imaging, with a PET ring as well. There was an irradiator, and there was lots of other equipment within the room. So it just went to show how easy it is to site these instruments within a busy or existing laboratory environment. The electronics cabinet is about the size of a small fridge, and it can be placed some distance from the magnet itself because there's simply cables that connect the two. We'll talk a little bit later about what allows this, but the only connection between the system and the outside world really is an electronics connection from the cabinet itself, and that's like a dryer plug. It's not more complex than that, and you would only turn the electronics on when you were doing your imaging session. And then of course power for the standard computer workstation as well. There's 3 different systems, the M3, the M5, and the M7. The only difference between those systems is the magnet itself and the size of that magnet. And the difference really comes into the size of the bore or the opening of the magnet. So the M3 is a mouse-only system, and that's the system that I used during the demonstration last week. The M5 has a slightly larger opening and allows us to acquire images from mice and small rats. And the M7 is a much larger opening, giving us mice and large rats up to about 600 grams. Here you can see all the technical specifications of each of the systems, all of them operating at 1 Tesla. They're all permanent magnets. And here you can see the electrical requirements for the electronics cabinet, either in Europe or North America. What makes this system unique is that it is a compact permanent magnet that's self-shielded. And so being a permanent magnet means that once the neodymium, which is the material that the magnet is made of, is magnetized in the field, there's no electrical requirement to maintain the magnetic field. And so with that, there's no heat being generated, so there's no heat that needs to be dissipated. And so other systems that may be available in the marketplace, you either have to have cryogens like liquid helium, or a tremendous amount of water to dissipate that heat. And that's a bit of an infrastructure requirement to allow that heat to be dissipated. Again, when you want to image, you simply turn on the electronics cabinet, and within a few minutes, the electronics have cycled through all their startup and they're ready to go. And typically in that time, you would be starting to anesthetize your animal and get things ready. The system itself is quite compact, but included in the exterior components of the system is shielding. And so that helps to create, to minimize the amount of magnetic field which is experienced by the environment around the system itself. You can actually see on the floor here this red line. This is the 5 Gauss line. And that line is defined where someone with a pacemaker, for example, should not go in case it affects the sensitive medical equipment like a pacemaker that they have. However, you can put a tablet, a computer, I've put my hotel room key on top of the magnet and not had it demagnetize or be affected. And so that's really how effective the shielding on the magnet is. It's quite quiet during its operation. You probably heard during the demonstration, you really didn't hear any change when the system was functioning or not. And typically, upon delivery, the system is installed within 1 day, and then we would complete 2 additional days of training to help you get up to speed with how to operate the system. If you can make out the electronics cabinet back here, that's the electronics for the MRI system. This system is actually the SimPET. And so I'll mention this very, very briefly at the end, but the M7 has the capability to have a PET insert inside. And so that allows for simultaneous PET MRI on the same animal. So this really does add to the capabilities of the system and the images that you can acquire. The animal handling system is quite simple. This pulls out of the magnet itself. The imaging coil, if it's a body coil, would slide over top of the animal, and I'll show you a video of this in a minute. And there is integrated heating within the bottom of the animal coil, or bottom of the animal handling bed. There's anesthesia, traditionally using isoflurane, both with anesthesia delivery as well as gas exhaust, so that there's not an excess amount of anesthesia building up in the imaging chamber. There's obviously connections for the coil to the electronics cabinet and physiological monitoring. So typically, I would only use respiratory monitoring, but there is the possibility to monitor additionally both temperature as well as the ECG signal. And that ECG signal can be used to perform ECG-gated imaging, and the respiratory signal can be used to perform respiratory-gated imaging as well. When choosing the system, it's really important that we consider, again, your anatomical targets. When operating at 1 Tesla, it's really important that we get the imaging coil as close to the anatomical target as possible. So for that reason, we have a number of different coils that we would choose from. The mouse head coil allows for the coil to sit very tightly towards the head, and you can see here that it's actually integrated into the nose cone. For the body coil, you would position the animal and simply slide the body coil over top, choosing the diameter that would best fit the mouse that you're imaging. Moving to the larger systems, there's rat head as well as 2 body coils, again getting up to the larger rats when needed. This is a quick video that shows the preparation of the system. So you would again simply turn the system on at the front of the device, and this would trigger the electronics to turn on. Traditionally using isoflurane as an anesthesia, although you can use injection if you need to, or alternatively using ex vivo samples as well. The mouse's teeth are hooked onto the bite bar, and that's where the anesthesia is delivered, pulled into the nose cone, which allows for the gas exhaust to pull out any excess isoflurane. The animal's positioned. If he's lower on the animal bed, the tail can fit through the little hole that was designed to hold the tail. The body coil would be slid over top of the animal. Again, if it was a head coil, that would be integrated into the nose cone. Position the anatomical target in the middle of that coil to give us the best image, and then join the electrical connection to the animal handling system, which again controls everything to the electronics cabinet. Once the animal's in position, it's simply slid into the magnet itself. You can see the marks on the front of the magnet. That allows us to position the animal directly inside the middle of the magnet, and that's going to be the area to give us the best quality image. From there, everything else is done within the software, as you saw during the live demo. I mentioned briefly the PET insert. So again, that's just an option in which would go on the opposite side of the magnet to what you just saw. And then the animal handling system would fit within that. And so this is an option on the M7 system and is an option for mouse imaging only at this point. And so here you can see some of the example images of doing, again, simultaneous PET MR images here on a tumor before and after treatment. These are some of the images that we acquired during the demonstration last week. So as we talked about during the demo last week, there's different image contrast that can be used with MR. We see a step through of our T1 and our T2 weighted image. So as I was talking about in the demo last week, T1 weighted images, the fat is going to appear bright, but the water will be dark. In a T2 weighted image, the water is going to be bright, and in the way that this image is acquired, because it is a fast spin echo sequence, which is simply how the image is acquired, the fat also looks bright, but what's most important is that the water looks bright. And so as we sweep through, you can actually see the bladder is quite small in this animal, and what we're looking for is the difference between a dark bladder on the T1 weighted image and a light bladder on the T2. Likewise, we see a similar difference in contrast in the tumor. So again, this is our orthotopic mammary fat pad tumor injected into the lower fat pad. And we can see the difference in contrast when we see the tumor. It was quite a large tumor. We can see it here. And if we look closely on the inguinal fat pads that we see here, we can actually pick out the lymph nodes as we sweep through. So there's lots of different anatomical structures that we can see. The kidneys, the intestines obviously are quite obvious here. The muscles, the liver, the heart, the stomach is there as well, moving through the kidneys now. So these images had a 250 micron in-plane resolution. The slices were 1 millimeter thick, and the acquisition took about 4.5 minutes, as we saw during the demonstration. So from there, once I got the images back after the demonstration, I loaded everything into Vivo Quant. The software visualization within the acquisition software really just shows the images that are acquired, but then we can take those images and we can bring them into a third-party software like Vivo Quant and do some analysis and measure some 3D regions of interest, which is what I've done here. By loading them into the software, I'm able to create a three-dimensional image, and we can draw different regions of interest around the tumor to create the tumor volume. So here we found the tumor volume to be 273 millimeters cubed. Then what we did was we moved on to the SCOV-3 animals. So these again had an IP injection of the ovarian cancer cells. And these tumors, like we saw on ultrasound, really showed up all over the abdomen. So MR was really nice to be able to see a whole body image of the animal and be able to start to identify where those tumors were located. So again, we're starting to look at differences and contrasts between the images, seeing the different anatomical structures. The squiggly lines that you're seeing are actually the water flowing underneath the bed to keep it warm. And so what I was looking at, and when comparing the T1 to the T2, is on the T1 images, the tumors look quite dark, and on the T2 weighted images, they look quite bright. And so what I'm going to do as this sweeps through, there's actually a tumor in the abdomen here coming up and around the stomach. And on the next image, I'll actually highlight these a little bit better for you, but as we go through one more sweep, I'll show you again. Okay, so as we're going through, we're going to look in the mid-abdomen here. We're seeing a nice bright structure. It wraps up around the stomach and terminates here. There's also a few in the lower abdomen that I'll show you on the next slide. So here we can see the three-dimensional representation of the different tumors that I was able to outline. Each one which appeared separately, I put in a different color just so that we could differentiate them from one another. This large one in the upper abdomen was very much connected and kind of wrapped around the stomach over to the left-hand side, which is very similar to what we saw on ultrasound as well. In stepping through, I was able to identify a number of other smaller tumors which were forming within the abdomen as well. The software was able to output the individual tumor volumes for each one. And the vivo Quant software, there's manual ways to do the tumor volumes, as well as some semi-automatic ways where you would draw a few different borders around the tumor, and then it would basically interpolate between those slices for you. And at any time you can correct or change those values as well. From there, I looked at some normal brain images, and I'm just going to let these sweep through, but we're able to see different structures in different views. Okay, so obviously seeing the eyeballs very clearly, looking at the lower brainstem, the inner ear components, both on the coronal and the sagittal view. The ventricles show up very nicely because this is a T2 weighted image, so anything fluid filled is going to be bright, like the cerebrospinal fluid. The palate is very clear on all of the images, and then different structures within the brain as well. So these images had a 200 micron in plane resolution, 1 millimeter slice thickness, and the acquisition time, as we saw during the demo, was about 7.5 minutes. We talked about throughout the previous two sessions the 5-2 system from Optiscan, and that's a system that if you want more information about, we're happy to provide it to you and connect you with the right people. At the end, we'll ask a poll if there's anyone wants additional information about a specific system. If you just click on that, I'll be happy to connect you with my colleague who would be happy to provide you with more information and have a conversation about the work that you're doing. At this point, I'm going to turn things over to Katie to move on and talk about the optical imaging system as well as this PET-CT. And then towards the end, she's going to take a look at the complementary nature of all of the imaging modalities that we did during the live demo and show you some examples from both of the models that we scanned the same animal on all of the different devices. And again, as we move forward, if you have any questions, please just put them in the Q&A dialog box, and I'll work with Katie to help get those answered towards the end of the presentation. Thanks again, and over to Katie.
Awesome, thanks Tanya. So as Tanya mentioned, I'm going to start by presenting the Newton 7 in vivo optical imaging system. And for those of you that joined us for the live demo last week, this was the first system that we were imaging on in that morning session. So to start off, I'm going to give a very, very quick overview of the applications of optical imaging, as I know many of you have been with us for the last couple of weeks where we went more into depth on this. We're going to spend most of our time discussing the technical specifications of the Newton system, and then we'll get into some of the images that we acquired during the live demo. Okay, so as I mentioned, there's a wide array of applications for optical imaging. These most commonly include cancer studies, neuroscience, studies looking at biodistribution or bioavailability, treatment studies specifically for bioluminescence imaging, as well as cell tracking and ex vivo imaging. Here we have two of the main examples. So for fluorescence imaging, here I'm showing a tumor expressing M. cherry. And then over here we have an example of bioluminescence where we have, these are orthotopic lung metastases expressing luciferase. And so both of these images were acquired on the Newton system. And so I want to spend the majority of our time today discussing the key technical features of the Newton system. So first, Wilbur has developed this Dark 9 camera, which is the latest generation of scientific CCD cameras, and it provides really unrivaled levels of sensitivity for both bioluminescence and fluorescence applications. The camera is a scientific 16-bit CCD camera, and it generates up to 65,000 gray levels with a dynamic range of 4.8 orders of magnitude. And so what this means is that very faint signals can be detected without saturating the strongest ones. The camera is also grade 0 with no dead pixels and is calibrated to NIST standards. The Newton 7 also benefits from exceptional image resolution. So as we can see it, even just with the naked eye looking at these images, and the resolution is 4.6 megapixels. And so high resolution is required in molecular imaging applications for better performance in pattern recognition, as well as image analysis. And so it's then possible to generate high resolution images with great sensitivity without the use of binning, and which is typically used in the standard optical system. And so we can see here in a typical optical system where the resolution is usually about 1 megapixel, it looks much more pixelated compared to this nice smooth image that we're able to acquire with the Wilbur system. Another benefit is the wide lens aperture. And so the main function of a camera lens is to collect light, which is very important in optical imaging. The lens aperture represents its capability to collect as much light as possible in a given period. And so its sensitivity is usually expressed by the range of f-stops. So the smaller the f-stop number, the larger the aperture. And so a lower f number denotes a greater aperture opening, which allows more light to reach that CCD sensor. And so the aperture of the Newton lens is 0.7, providing the best sensitivity and speed, which allows us to reach the lowest limits of detection compared to standard systems that have that smaller lens aperture. And so for bioluminescence, this means the image acquisition time can be significantly reduced, which we saw in the live demo last week. And for fluorescence, ultrasensitive detection facilitates the use of shorter excitation exposure. And so this can reduce things like photobleaching, phototoxicity, as well as lower dye concentrations. The CCD camera is motorized on the Z-axis, and this is to accommodate various fields of view according to the number of animals that you want to image. So you can choose up to 5 mice or 3 rats to be imaged simultaneously. On the lowest position, the camera enters the macro imaging mode with a distance of only 6 centimeters to focus on a specific region of interest, such as the brain, and this will allow for gains in sensitivity. Since the closer the sample is to the camera, the better. Now the heated stage is also motorized in the XY axis so that the subjects are always at the center of field of view, whether regardless of the camera's position. And this can be controlled by the user from the computer to easily move the stage and focus on a specific region of interest throughout your imaging session. And so this is shown in the top here. Now the excitation light panels are also motorized in the x-axis, shown here on the bottom, and this is to provide a unique scanning technique so that the excitation light is uniform all over the sample surface. And this really provides a more accurate fluorescence quantification. There are 8 excitation channels included in the Newton in order to cover the complete spectrum from blue illumination all the way to the near spectrum. And the powerful light generated by the spectra panels is categorized as laser class 2, producing a monochromatic light of a very narrow band illumination. And this reduces the cross stimulation and increases the sensitivity of your images. There's also a dual magnetron sputter-coated filter technology, which will ensure transmission above 90% and very narrow band cutting for improved spectral separation and increased sensitivity. So this will be important for those of you interested in doing some spectral unmixing, looking at multiple fluorophores within the same animal, for example. Wilbur's also developed a unique, cost-effective and highly accurate way of achieving 3D tomography data. And so with the help of multiple 3D near cameras, the topographic image of the animal is acquired and then reconstructed into a volume. The main CCD camera then acquires multiple images of the signal using various emission filters from wavelengths in the spectral emission of the probe you're using. So whether this is a luciferase or a different fluorophore. And then the signal can be reconstructed with the use of an algorithm and repositioned within that topographic image of the animal. And so the 3D tomography can be visualized with a library of digital organs. We mentioned this a bit at the live demo, but we weren't able to show you due to time restraints. But whatever the mouse or rat's size or position, the digital organs and bone structure will automatically adapt to the image. And you can choose to add or hide individual organs and bones and have access to the axial, sagittal, and coronal views in regards to your signal. The data of the signal is then quantified into a volume that can be measured or compared against either other models or within the same animal over time. And so, as I mentioned, this can be super useful for those of you looking into treatment studies. Okay, so jumping into some of the images we acquired during the live demo. So first, I just wanted to show an example data set that comes out of a single acquisition. So as long as we are checking off that overlay box, which we were doing, we get 3 separate images for each acquisition. So we have a signal-only image shown here, and this is really what you're going to be playing with in terms of adjusting your window and level, as well as for quantification purposes. We then have a nice bright field image, which gives us some anatomical reference, and then the overlay image, which just merges the two and is now multicolored. And you can, as I showed in the live demo, you can adjust this based on what you're trying to show. So if this was the GFP tumor, we can adjust our color scale to include green right in the analysis software. So just covering a couple of the models that Tanya has shown already. Here we had a model of human ovarian cancer. So this was an IP injection of SCOV3 cells. And because it was an IP injection, these cells really can go anywhere in the abdomen and they're very diffuse. And so we see them all over. This signal was a little confusing to us on its own, but we wanted to show it because it really helped to guide us with the modalities that came after. So with MRI and ultrasound, Tanya was able to, as we'll see in a couple slides, Tanya was able to use this signal to guide her and find those tumors throughout that abdominal region. We also had a dual mammary fat pad model of human breast cancer. So these were the 231 cells. And we can nicely see the difference in signal provided by those tumors of varying sizes. We also showed some imaging of our phantoms, and this was to demonstrate fluorescence imaging. So here we had a gelatin phantom where we've placed fluorescent beads throughout the phantom, and this was done at 480 nanometers. And then we had a multiplex example. And so this is a gelatin worm, and we have some fluorescent beads, which are shown in green. And we also have some luminescent beads shown in red. And so this was just to show you the capabilities of the multiplexing. You really can, based on your study, you can really substitute any 2 probes in here. And we've actually assigned our bright field image in this case as blue. So you could do as many as 3 different fluorophores or luciferases within the same animal. Okay, so just very quickly, I'm going to give a very brief overview of our PET-CT system. We do want to spend most of our time discussing the systems that we were able to image with during the live demo, and so I'm going to keep this quite quick. If you are interested in more resources, I encourage you to go to our website where you'll be able to find some webinars that solely focus on the PET-CT system. Also feel free to reach out to either Tanya or myself with the emails that are provided at the end of the presentation, and we'd be happy to answer any further questions that you might have about the PET-CT. Okay, so I'm going to go over the product overview as I did with the Wilbur system. We'll talk about some of the things that make the Scintica PET-CT system unique, and then we'll briefly cover the multi-animal handling system for those of you interested in simultaneous imaging. Okay, so the Scintica systems have been designed and manufactured for use in small preclinical imaging spaces and within existing lab spaces. So Similar to the MR system Tanya mentioned, these systems are self-shielded to meet FDA guidelines, and this means that there's no special room preparations needed for the system, and the operator and others that can remain in the room during image acquisition. With this in mind, the systems can be easily placed within existing lab spaces, imaging cores, or even animal facilities, which is great. All of the systems come with an integrated animal handling system, which can include anesthesia, gas scavenging, heating, as well as physiological monitoring. And then images from the systems can be saved in a number of different formats. These include DICOM, interfile, or JPEG, meaning that they can be taken to any number of third-party software options for analysis. And typically, we provide vivo quant if needed for your analysis. So Scintica offers both a PET or CT compact model. These systems are ideally suited for mouse imaging. They have a bore diameter of 55 millimeters. Acquisition times are short, with 15-second acquisition for an anatomical CT image. And the PET system has 4 rings, including 32 of Scintica's phosphate detectors, which I'll mention a bit more in a couple slides. Now, 3D reconstructions of the PET system or PET image take less than 2 minutes to perform, giving a resolution around 1 millimeter, similar to that of the larger Super Argus systems. So if we move on to the Super Argus systems, these are a bit larger. You have the choice of either PET alone, CT alone, or the combined PET-CT, of course. There's 3 different options for bore size. So the little r is ideally suited for mice, rats, other small animals such as marmosets, but it does have a bore size of about 90 millimeters. The big R is a little bit larger at 160 millimeters, and this will be ideally suited for larger animals, so up to a rabbit, or multi-mouse imaging, as I'll show you in the next slide. The P model has been designed for even larger animals such as non-human primates, canines, and pigs, and this one has a bore size of 260 millimeters. Now from there, each PET system has a choice of how many PET rings to include. So 2 rings would cover 50 millimeters in a fixed axial field of view, 4 rings will cover 100 millimeters, and 6 rings will cover 150 millimeters. And in all the systems, there is a dynamic axial field of view, which will extend the area covered during imaging, and this is selected by the researcher. The CT component of the Super Argus systems has been designed for longitudinal studies, so it focuses on low-dose radiation while providing high resolution and rapid scan times. Now, the Super Argus system is considered best in class for many reasons. Firstly are those unique phosphate detectors that I mentioned. These are composed of 2 different phosphors sandwiched together, so hence the term phosphate. And these detectors are used in both the compact and the Super Argus systems and really provide true depth of interaction information and thus contribute to many of the other unique features of the system, including high resolution, resolution uniformity across the entire field of view, which is really important, as well as improved sensitivity. Now, Scintica is able to design any variety of multi-animal handling systems to meet specific needs. However, most commonly, researchers want to image as many animals as possible to either improve throughput or to work within the half-life of the radioisotope that they've made. If the half-life is short, so for example, carbon-11, then being able to image 4 mice simultaneously is going to allow you to use more radio tracer faster for your imaging than doing mice 4 sequentially over time. Now, this 4-mouse animal handling system fits within the big R model, having that 160 millimeter bore. And each animal chamber has individual controls for anesthesia and heating. And a separate workstation can be added onto the system to allow for offline preparation of the animals while another set of animals is being imaged. And so here are some example images using the multi-animal handling system. So here 4 mice were imaged simultaneously, and we can see here that the resolution and sensitivity are maintained throughout the entire field of view. And this is, as I mentioned earlier, due to the state-of-the-art phosphate detectors. Okay, so just to finish off, I really want to focus on those images that we acquired during the live demo and the complementary nature of them side by side. And so, as I mentioned, the first one we'll talk about is the SCOV3. So this was a human ovarian cancer cell line. Again, it was injected IP. And as I mentioned earlier, the optical imaging on its own in this case was a little confusing to follow. But interestingly enough, we were able to use this to guide our imaging using ultrasound as well as MRI. And Tanya was actually able to find these throughout the abdomen. And so we see one of those tumors here. We also can see quite nicely after Tanya has rendered these 3D volumes, we can see what's likely this tumor here in the optical imaging. We can see it up here. It may be a combination of these two signals as we see that this actually joins together. We can also see a very faint signal a little bit lower down, which may be this one. And we also see this tumor here, which is likely this signal, potentially even further down. But it's interesting, had we not had optical, I'm not sure we would have been as determined to search that entire abdomen in the MR to find this many tumors. But the optical on its own is also a little confusing. So having all three of these modalities is really interesting. We're able to see across the board. Now, we also looked at a orthotopic mammary fat pad tumor model. And again, we have really nice BLI signal in the mammary fat pad. And this is representative of viable tumor burden only, because keep in mind, we're imaging firefly luciferase in this case. So as I mentioned in the previous webinar, there are cofactors needed to acquire signal here. And so this means that only viable tumors are going, or viable tumor cells, sorry, are going to give us signal. And so this is really just a relative measure of tumor volume. We can, however, get a more accurate measure of this tumor volume using both ultrasound, which Tanya is showing nicely here. And we also see it with MRI. So just looking at either an individual slice on the T2 or T1 image, and then we can see the full volume over here, which corresponds quite nicely to both our optical and our ultrasound. And we can see the measurements she's acquired here based on the analysis tools. These are very close. Okay, so I'm going to give it back to Tanya, who's going to launch our final poll.
Perfect. Thanks so much, Katie, for taking the time to walk through those two different imaging modalities. And so right now, we just like to ask if there's anyone who wants additional information about any of those imaging products that we talked about. And we'll just give everyone a little bit of time to respond to that poll question. And again, if you've got questions that you'd like to pose in the Q&A dialog box, we'll use the last very few minutes to start to cover some of those. And if there's any that we are unable to answer, I'll either reach out to you guys directly to answer them, or we'll create a transcript if there's a few more than we can handle in reaching out directly to people. I'll give everyone just another couple seconds. And I'll start looking at the questions that have come through. Excellent. Thanks everyone for taking the chance to answer the poll question for us. In the time that we do have remaining, I'll get Katie to jump towards the Q&A slide. Just our emails are there. If you have specific questions for either of us, please feel free to reach out. There were just a few questions that came through during the presentation, but again, if you have extra questions, please feel free to use the Q&A dialog box and we will get to them. The first one I'll handle is a question of, can the Prospect T1, that's the high frequency ultrasound system, can the probe for that system be removed for manual handling? And the answer is yes. So the probe can come out of the animal handling platform, and you can basically swing that arm out of the way and you'd be able to handhold the probe if that's how you're more comfortable in acquiring the images. The benefit of using the animal scanning platform is just the stability of the probe and being able to acquire a nice movie of the structure of interest. But if you're more comfortable holding it because you're an experienced ultrasound user, that's no problem. If you're someone new to using ultrasound, I really do find the scanning device quite helpful. in helping to acquire and also maintain very clean images. Another question also surrounding the ultrasound system is what parameters can be measured from a B mode or an M mode image. A lot of those measurements and calculations are actually quite similar, and it's just different equations used to calculate them. Most often we're looking with a B mode or an M mode image of the heart, we're looking at systolic function. And so measurements of stroke volume, ejection fraction, ventricle volume, and diastolic volume and systolic volume can be measured, again, using either technique. And it's just what assumptions you're making about the shape of the ventricle based on the technique you're using. You can imagine with an M mode image, you're looking along a single line. So I almost equate that to a one-dimensional image, and the ability to calculate systolic function accurately depends on where you place that line. If you're doing a B mode image, that's a two-dimensional image, and that provides you with a little bit more flexibility to incorporate areas of the heart which may be functioning and not functioning. And so again, those measurements all feed into equations that make assumptions about the shape of the heart. There are also measurements where you can simply look at the flow that's going out through the ascending aorta. And so that's using pulse wave Doppler, and you're looking at the area under that curve or that peak, as well as the vessel diameter, and in that you're getting stroke volume, and from the heart rate you can then get cardiac output. With that measurement, however, you're not getting ejection fraction and things like that, which would simply come from the volume measurements made on the ventricle. I think at this point we've reached the 60-minute mark. So I'd like to thank Katie for taking the time to walk through this presentation with me today. I hope that you were able to get some more information about the specific products that we've spoken about throughout the imaging mini-series. And as Katie mentioned, if you have any questions or want to discuss your research further, she and I are both available at any point to set up a meeting and talk about your specific research goals and perhaps how any of these instruments could help you achieve them. And of course, I'd like to thank everyone who was in attendance today for taking the time to join us, and we look forward to seeing you at any of our future Scintica events.